Hello class, my name is Kelly Neal and we are going to be talking about an introduction to healthcare agencies. So when we're looking at going into a healthcare agency, whether it's a hospital or a nursing home, for many of us this is going to be our first exposure to it. And so there are many things we need to learn about what these healthcare agencies do and what our role is in them. So when we're looking at healthcare agencies' purposes, it's for health promotion. It's for disease prevention. It's not just for someone who's sick all the time. It may be for someone to keep them well, wellness programs, detection and treatment, so hopefully we can catch something before it becomes a worse disease, for rehabilitation if it is something that we have to do some kind of surgical procedure for. All of these are going to be integrated to provide the most optimal care for our patient. The different types of agencies that are available is there's hospitals and healthcare systems. And so what most hospitals have done is they have joined with other hospitals to become systems. So for instance, St. John's Hospital is part of Dignity Health Systems. So they're with a wide range of multiple different hospitals. The advantage to that is when you're trying to order supplies, when you're trying to get deals to keep your costs low, to be able to stay more viable and fiscally responsible, you can order things at bulk, you can get better prices for them. Here in Ventura Community Memorial Hospital, they joined with Ojai Valley Hospital, Ojai Continuing Care Center, and the Centers for Family Health, and they are a CMHS healthcare system. So they can provide systems or provide services in a much more economical way. So hospitals and healthcare systems, they deal with inpatient and outpatient care, and they deal with acute problems, chronic problems, and terminal illnesses. So when we refer to something as an acute illness, we're referring to something that comes on suddenly. So for instance, an appendicitis or influenza, that would be an acute illness, something that comes on suddenly. We're hoping that we can take care of it right away and get you well and on your way quickly. Chronic illnesses are things that are long-term. So diabetes, for instance, would be a chronic illness, or COPD, chronic obstructive pulmonary disease, which is a long-term illness. Arthritis can be a chronic disease. Things that we can manage it, we can take care of it, but we may not necessarily be able to cure it. Terminal illnesses are things that are going to probably end in death, where the expectation or what we think is going to happen is the long-term outcome is going to be death. So certain types of cancer, dementia will usually end in death as well, eventually. There are also rehabilitation and subacute care agencies. So rehabilitation centers are places normally when a person goes into a hospital, insurances will only pay for a few days of their care while they're in that hospital. They want them out of the hospital as soon as possible. So if the person's not ready to go home, they will usually go to a rehabilitation or subacute care agency where they can get a little bit more care than they would being at home, obviously, but they don't need quite as much as they did when they were in the hospital. Now, long-term care centers have evolved quite a bit. It used to be a long-term care center would take care of someone when they could no longer care for themselves at home, and they would go into the facility and they would stay there until they died. But now long-term care facilities have kind of become half long-term care, half rehabilitation. Many people go into these facilities for a month or two just to, let's say they've had knee surgery or they've had a hip surgery. They'll go into these long-term care facilities, into these nursing homes for just some extra rehab to get them better so they can then go home and take care of themselves. Some people, though, still go into long-term care facilities with the plan that they will stay there until they die. We will be doing our clinical time in the long-term care facility, partly because that is a CDPH requirement. The California Department of Public Health says that the majority of jobs for CNAs are in long-term care, and so that is where they want us to do our clinical time with you. Now, there are also, in the long-term care setting, there are also what we call memory care units. And memory care units are specific for patients with dementia, with Alzheimer's disease, and they can be locked facilities. Normally, nursing homes cannot be a locked down facility. Patients have the right to come in and out of the facility. So if you have a dementia patient who's confused and wanders, that obviously can present a problem. Memory units are units that only take care of dementia patients, and they can be locked from the inside, where you have to have a key or a pass code to be able to get out, so we can keep those patients who tend to wander a little bit safer. Assisted living residents, the difference between a long-term care center and assisted living residents, these patients still need some assistance. They need help with activities of daily living, but they have to have some mobility. They have to be able to get out of the facility if there was a fire, so they have to have some mobility, and their health has to be stable. Okay? If their care is constantly deteriorating, then they would do better in a long-term care center. Mental health centers are for patients that have obviously mental health diseases and are not safe to be on their own at home. And then home care agencies. Now, home care is obviously, most people would prefer to be in the home care setting. If you couldn't care for yourself anymore, most people would prefer to have somebody come in and take care of them in their home than to have to go to a long-term care facility and live in an environment that they're not familiar with. But unfortunately, many insurances do not cover home care, so it can get very expensive. Hospice and palliative care. Hospice care is for patients that are dying, that we expect to be dying usually within the next 6 months. And the person is accepting of that. They are no longer trying to actively seek cures or trying to prevent this from happening. Hospice care is giving them the support that they need to improve their quality of life and their pain management until they die. Where palliative care is similar, palliative care, the person may have a terminal illness. They may not be, this terminal illness may last a while, but they're still actively seeking treatments and cures, but they still need that help to help improve their quality of life. So when a person does go into a home, they are supposed to have things done for them. We're supposed to make their quality of life excellent. We're supposed to help try to keep their deterioration from getting worse. So when a person comes into a nursing home, the expectation is that we will help keep them stable or help get them better. Okay. Now, we do understand that there are some disease processes that are going to continue to get worse no matter what we do, but in general, we are supposed to be helping them get to the most optimal level of health that they can. So organizations, hospitals, nursing homes, they have some type of organizational flow to them. And generally there will be a board of directors, a group of people who are vested in trying to make the place meet the objectives of the facility as much as they can. There's administrative services, and usually there will be a CEO or a chief administrator that is overseeing the entire facility. There is information services offered at a facility. So how are they going to protect all of that healthcare information and be able to make it accessible to the people who need it, but private from the people who don't need it? There's therapeutic services like nursing. Nursing would be a therapeutic service. Physical therapy is a therapeutic service. Occupational therapy, respiratory therapy, those would be therapeutic services. Diagnostic services like laboratory, and support services, administrative support, housekeeping support, all of that would be support services. Now, the thing I loved about this picture is it shows you the connection between people. You have a healthcare team, and it's always the healthcare team, not just nursing, who's trying to promote that patient's health, try to get them to their optimal level of care, trying to get them better. So it takes a team to be able to do this. And the patient is going to connect with every part of that team but so does the nurse. So the nurse is going to connect with the doctor and occupational therapy and physical therapy, the social workers, respiratory therapy, family, in addition to that patient. And so good communication skills are extremely necessary in healthcare. You need to be able to communicate clearly, to pass on proper information that people need to know. And so it's just extremely critical that you learn good communication skills. Nursing services is its own department. So it's part of the therapeutic services of an overall organizational chart. But nursing services is the largest part of a healthcare agency. It is the largest part of a hospital. It is the largest part of, the workers of a hospital, of a nursing home, of an assisted living facility. So nursing will have its own director. So they usually have a director of nurses. At some places you go to, they might refer to it as vice president of nursing or vice president of patient care, but it's director of nursing usually in a nursing home. Then there are nursing supervisors and nursing managers. Nursing supervisors usually oversee the entire facility on their shift, and nursing managers oversee a complete department 24 hours a day that they're responsible for it. And then we have staff RNs, LVNs, and CNAs. So when we look at what the difference is between an RN, an LVN, and a CNA, many of you are taking this class because it's a necessary prerequisite to get into the RN program here at Ventura College. And the RN program, as you know, there's a ton of prerequisites, a lot of science courses you have to do. You usually have at least a year and a half of school in before you can even apply to get into the RN program. So it always amazes me that a 2-year RN program, you've already got at least 3.5, if not 4 years of college under your belt to get that 2-year nursing degree. So there are Associate of Science degrees in nursing, which is the 2-year programs, like what we have here at Ventura College. And there are 4-year Bachelor's of Science degree programs, like what you see at Cal State Channel Islands. Now, even if you do a 2-year degree here at the college, you can then go for what they call a bridge program, and it usually takes another year to year and a half, and you can get your bachelor's degree. Now, RNs will do assessments, medications, treatments, and then basic care, depending on what type of workflow the facility uses. LVNs, licensed vocational nurses, they do very similar things to what an RN does. Usually admission assessments they do not do, and they do not do IV medications, IV blood products. Those would have to be done by the RN. Certain treatments might have to be done by the RN. But otherwise, they usually are looking at prerequisites plus 18 months of school. And I will tell you, usually when students come up to me and say, I'm thinking about an LVN or an RN, I'm going to always try to talk you into an RN. Because as an RN, your jobs are limitless. There are so many different things as an RN that you can go into. You can go into utilization review, patient care, critical care, emergency department. You can do doctor's office. You can work for big insurance companies, research firms. There's just so many things you can do with an RN degree. But with a licensed vocational nurse, you have quite a bit more limit as to the jobs that are going to be there for you. And then the pay is a lot less as well. Certified nursing assistant is what we're learning how to do. And as a CNA, we are going to be assisting with activities of daily living. And those activities of daily living are those things that you probably take for granted. You get up in the morning, you brush your teeth, you eat breakfast first and then brush your teeth. You take your shower, you get dressed. Those are activities of daily living. And we're going to be taking care of people that have had disabilities, and some of them multiple disabilities, and can no longer do that for themselves. So we're doing delegated tasks that are given to us by the LVN and the RN. We do not give medications. The only exception to that is a topical over-the-counter ointment we can do. We cannot do over-the-counter pills, but we can do over-the-counter ointments, and we do not do treatments. So we will be stopping here, and we'll do just a short little knowledge check of us, and then we'll go on to the next section.